Hi, Miss Nikki here. Welcome to Chapter 21. We're going to cover kind of an overview of the lymphatic system. Remember that we talked about 15% of the fluid that's pushed out from the arteries into the capillary beds, or arterioles into the capillary beds, is picked up by the lymphatic system. About 15% of that fluid gets pushed into these lymphatic vessels and then cleaned through these lymphatic nodes. Basic definitions here, you can see what's the function. It's to return excess fluid in the body tissues back to the blood to maintain that blood volume. And we're also going to see lymphocytes here, other immune cells that are going to help clean that excess fluid before it gets dumped back into the vena cava. The lymphatic system has vessels, we have lymphatic organs. The fluid is called lymph. We can see from this image that we have both lymphatic vessels and then we have these lymphoid structures. So the vessels you can see in green are all running in appendages. We can see primary lymphoid structures, so the thymus, if you remember, the thymus helps educate immune cells, right? Then we have bone marrow, which is the site of production. Remember, hemocytoblasts make white blood cells. And then we have these secondary lymphoid structures, things like tonsils, like lymph nodes. So we have cervical here, axillary here, inguinal here. That's the major collection. We also have a spleen. The spleen's also going to have white blood cells. Remember, before we talked about the fact that red blood cells can be stored here, aged red blood cells. And then we have something called malt, so mucus-associated lymphoid tissue in the intestines, specifically small intestines. So the characteristics of lymph. Lymph is what we call the fluid. If it leaves the blood capillaries and it's not reabsorbed on that venule side, right? The interstitial fluid moves into a lymphatic capillary, and once it's in the lymphatic capillary, we now call it lymph. So it goes from interstitial fluid to lymph. What's in lymph? It can have water, it can have dissolved solutes, it can have small protein, cell debris, pathogens, or even cancer cells. Lymphatic capillaries are really small. They're closed-end vessels that absorb interstitial fluid. So you're going to see that fluid really only goes in. It shouldn't be coming out. They're interspersed around blood capillaries. There are some tissues that do not have lymphatic capillaries, but we're starting to see some. I just read an article about how they found some lymphatic vessels in the brain. So who knows, maybe we just haven't found them all yet. Slightly larger than blood capillaries. They have overlapping endothelial cells. And these flaps are going to allow fluid to enter, but it cannot exit. So we're also going to see some anchoring filaments that are going to help hold these cells to nearby structures so they don't move one way or the other. And then when we come back and talk about digestion, we'll talk a little bit about lacteals, these lymphatic capillaries that are going to absorb lipid soluble, right? So fat soluble substances from the GI tract. So we'll come back to this when we do digestion. I think this is a really nice image showing you how interwoven these lymphatic capillaries are into the capillary bed. So we can see over here, we've got our arterial side, we've got our venule side, and we see our capillary bed. And then you see the lymphatic vessels, lymphatic capillaries are kind of intertwined here. And this is what we meant by a gap. So it's layers of cells that have these gaps. They're overlapping, but they leave these little gaps. So if the pressure is low inside the lymphatic vessel, and the pressure is high out here, then that fluid is going to move from high to low. So again, if it's out here, it's interstitial fluid. As soon as we move it into the capillary bed, then it becomes lymph. We kind of already saw the picture. They're just talking about how does that lymph, or how does the fluid in the interstitial space, interstitial fluid, how does it move into the capillary and become lymph? It has to do with the hydrostatic pressure of the interstitial fluid pushing into those openings, those flap-like openings that cause the fluid to move into the lymphatic vessel. So these are going to move through larger and larger vessels. So lymphatic capillaries would be the smallest. The capillaries are going to merge into vessels. The vessels are going to merge into trunks, and trunks are going to merge into ducts, and then the fluid is going to be returned to blood circulation. And we're going to see where that entry point is in just a moment. So wandering cancer cells can establish secondary tumors. This is something that we would call metastasis. So if a cancer cell is picked up in the lymphatic system and it journeys to another body and another organ and sets up tumors there, that's metastasis. So sometimes when they're removing breast cancer, they're also going to pull out some of the lymphatic tissue because they don't know if those cancerous cells have managed to break free from the primary tumor and they're kind of just stuck in that lymphatic area or in a lymph node. Lymphatic vessels are fed by lymphatic capillaries. They're adjacent to arteries and veins. They're going to have that same kind of structure that we've seen before, right? They're going to have valves. Ooh, this is kind of interesting. Do these look a lot like veins, right? Lymphatic system acts as a pump and moves lymph. What helps move lymph? Skeletal muscle, respiratory pump, pulsating movement by arteries nearby, and smooth muscle contraction of larger lymphatic vessels. So this should remind you a lot of veins. So we can see that lymphatic vessels are going to drain into trunks, and trunks are going to drain into ducts. The largest lymphatic vessel is the lymphatic duct. It's going to bring lymph to the venous blood circulation. There's a right lymphatic duct, and it's going to drain the right quadrant of the body, the right side of the head, the neck, the right upper limb, the right side of the chest. It's going to deliver the lymph to a junction at the right subclavian and the right internal jugular vein. The thoracic duct is the largest lymphatic vessel, and it runs from the diaphragm to the junction of the left subclavian and left jugular. And look at all of the body, the majority of the body is drained into this thoracic duct. So you can see area drained by the right and then area drained by the left. So it's about a 75-25 split. And where are these going to drain into? So here is your right subclavian vein, here's your jugular vein, and you're going to see that the lymphatic duct is going to dump right kind of into the branch of where those two meet. Remember, this would be our right brachiocephalic vein. This would be our left brachiocephalic vein. This is our left subclavian, and this is our left jugular. And here we have the thoracic duct that comes in and dumps into right where that junction is as well. So sometimes you can have lymphatic drainage issues. So accumulation of interstitial fluid due to some sort of interference with lymphatic drainage. This is going to cause swelling and pain. Remember, we said 100% is being dropped off to the capillary bed. The venous return is about 85%, and 15% is picked up by the lymphatic system, right? So if you're constantly dropping off 100% and only picking up 85%, and something happens that this 15% is not being picked up by the lymphatic system, then you're going to have swelling. Usually it's some sort of blockage of a lymphatic vessel. It could be a tumor. It could be some sort of scarring. Usually try to control this with compression garments, so limit the amount of blood and fluid that can accumulate in the tissue, exercise, massage, and there have been issues in the past, infections with parasitic worms, elephantitis, and that would cause a blockage of the lymphatic vessel. Lymphoid structures, we have primary lymphoid structures and secondary. So the red bone marrow here and the thymus, these are involved in the formation and maturation of lymphocytes. So remember, this was that education. We education of T cells, right, to recognize body cells. And then the red bone marrow, hopefully you remember hemocytoblasts, and that those make red blood cells and white blood cells and platelets, right? So secondary lymphoid structures, they do not create or make lymphocytes, but they house them. So these are sites of initial immune response. These are going to be lymph nodes, the spleen, the tonsils, lymphatic nodules. We didn't really talk about these. And then malt. So red bone marrow. Remember, we're talking about skull. Femur is a good place. Head of the femur, head of the humerus. This is the site of hematopoiesis. This is the production of the formed elements, T cells, B cells. The T cells are going to migrate to the thymus to complete the maturation. So since we kind of did these PowerPoints out of order, we kind of talked about immune when we talked about blood, a lot of this should be a repeat for you. Remember, the thymus is involved in the maturation of the T cells. So in children, you're going to have a really large thymus, and it's going to grow until puberty. Then it's going to start regressing, and then eventually it's just going to be replaced with adipose tissue. So there's lobes, and you're going to see that in these lobes, there's a cortex, which is the outer, and medulla, which is the inner. So the cortex is going to contain the immature T lymphocytes, and the medulla is going to contain the mature lymphocytes. They've been educated. That's what they like to say. Educated T cells. So just in case, we really didn't talk about the thymus all that much, but the thymus is here. You can see it's much larger in children and much smaller in adults. And at some point, it can atrophy to the point that it's just fat. You can see listed here secondary lymphoid structures. So again, these are just going to house lymphocytes. So they don't create them or mature them. They're going to house lymphocytes and other immune cells. Their spleen, lymph nodes are ones that we'll talk about. They have a capsule, dense, irregular connective tissue. There's going to be some other secondary lymphoid structures that don't have a capsule or it's incomplete. So tonsils, malt. Lymph nodes are going to filter the lymph and remove any unwanted substances. We're going to see clusters of them occurring in certain areas. So cervical receives from the head and the neck. So it's cleaning any blood coming from the head, neck. I often think, mouth, things that you inhale, right? So any of these excess particles that don't get picked up by the venous return are going to go through the interstitial fluid, get drained into a lymphatic capillary, get into a lymphatic vessel, and then they're going to be cleaned by lymph nodes, right? So there's white blood cells in your lymph nodes just waiting for the fluid to flow through. So cervical, axillary, so this would drain both of the arms, and then the inguinal legs, but then also think of that urogenital area where you're exposed to external environment, bacteria, right? So here's a picture of a lymph node. Afferent, remember afferent means ascending, so going in, and efferent means exit or going out, right? So in, entry, ascending, efferent, exiting, draining, however you want to think about it. So they're showing you here the afferent lymphatic vessels. So the fluid would be entering here, and that fluid kind of circulates in this lymph node and then comes out the efferent. And you can see there's many entry points, many afferent, but there's only one efferent. So this helps kind of slow down the fluid so that it can be cleaned. So lymph flows through the nodes. It enters several afferent. It's going to be monitored for foreign materials. You're going to have lymphocytes that may initiate immune response, right? And then the lymph is going to exit through an efferent. Really what we're trying to do is slow down the flow so that these lymphocytes have enough time to do this, initiate that immune response. You may have heard of this term lymphoma before. So you can have some sort of growth. It can enlarge a lymph node. There's Hodgkin's lymphoma, there's non-Hodgkin's lymphoma. Usually the Hodgkin's is going to affect young adults and then people over 60. Caught early, it can be cured. We can get rid of the tumor. We can radiate the tumor, chemotherapy, stop it from spreading. Non-Hodgkin's lymphoma is more common. Some of the kinds are aggressive. Some of them are slow growing. So something we need to pay attention to, or that you're probably going to see at some point in your allied health career. Spleen, this is another secondary lymphoid structure, and we can see that it is the largest lymphoid organ. We know where our spleen is located. We haven't talked about white pulp versus red pulp tissues in the spleen yet. So in the white pulp, you're going to have T and B lymphocytes and macrophages. So I basically think white blood cells. In the red pulp, you're going to have erythrocytes, red blood cells. You're going to have platelets. You do still have some macrophages and some B lymphocytes. And this is where we store erythrocytes and platelets. So here you can see the spleen. We can see the spleen in this image here. So a nice basic summary here. What is the spleen doing? The spleen is monitoring your blood, right? So the white pulp monitors for foreign materials. That makes me think white blood cells, right? We are going to have macrophages. They can get rid of or phagocytize bacteria and debris, but also maybe you just have a defective red blood cell or platelet that's no longer functioning, right? So splenic artery is going to bring the blood flow in. The spleen is going to monitor that blood as it's coming in, and then the splenic vein is going to return that blood. So you can see how this is, again, kind of like a structure that's going to monitor the blood. If there's anything in it, any bacteria, debris, or anything that doesn't need to be there, you're going to have macrophages, white blood cells, that are going to eat those foreign particles, clear any defective erythrocytes, and then store any excess erythrocytes or platelets. Sometimes the spleen needs to be removed. So if the spleen ruptures, if there's some sort of abdominal injury, if there's some sort of infection or tumor or cancer or some sort of blood disorder, you may have some issues with infection, but you can live without a spleen. Tonsils, I'm sure we've all seen swollen tonsils either on ourselves or on children. We're going to come back and talk about these when we do respiratory as well, but you can see there's the pharyngeal tonsil, which is here, and the palatine. That should make you think of, remember the palate? We had the maxilla, and we talked about the palatine bone, so then there's the palatine tonsil. And then we have the lingual, and you can see it's kind of under the tongue. Tonsils, again, we're still talking about secondary lymphoid structures. These have immune surveillance as well. So anything that's inhaled or ingested, it can be trapped in your tonsils. So basically, bacteria gets in, and then it can't escape. And it's going to be attacked by white blood cells, by lymphocytes. So I hope we're kind of seeing a pattern here that a lot of these lymphoid structures, these secondary lymphoid structures, are ways to either trap or house material that's already been targeted, a place for your lymphocytes to kind of digest and break down any sort of pathogen that's not supposed to be there. Lots of people have tonsillitis, inflammation and infection of the tonsils. They become red, they become enlarged, they can block the pharynx, and so they can actually obstruct breathing and make swallowing difficult. Usually some sort of virus or bacteria gets into the tonsil and it can't be broken down fast enough, right? Your immune system, it's just too much for your immune system to handle, and then we might want to surgically remove your tonsils. Last one I want to talk about are these lymphoid nodules. These are clusters of lymphoid cells. They're not completely surrounded by connective tissue. They're found in every body organ. They help defend against infection. Some of them are going to group together and form kind of these bundles. If you got to see them on the anatomage table, that's great. If not, hopefully you'll get to see those at some point. So one of the examples is malt. So malt is this mucus-associated lymphoid tissue. We have this in GI tract, respiratory, genitals, urinary tract. So this helps defend against foreign substances, lots in the small intestines, especially the ileum. There's something called Pryor's patches. These are large collections of lymphoid nodules within the GI tract. So you can imagine how this would be useful if we're here in the ileum of the small intestine. This is the major site of absorption, right, of the food that we eat. Again, I hate to break it to you, but all food has bacteria on it, right? Or it could have virus particles on it, or it could have fungi on it. So this makes sense that we would have this lymphoid tissue located in these major sites that are exposed to the external environment. Hopefully they'll trap particles. The white blood cells that are hanging out in these lymphoid structures can attack whatever the pathogen is and break it down before it can enter into our cardiovascular system. So hopefully this made sense, and don't freak out about this chapter. You can see a lot of it is a repeat. This video is like 20 minutes long. I went over about 30 slides. Really stick to the learning objectives. I think there's maybe 5 questions about lymphatic system on your test. Much more important to understand the heart and blood vessels and cardiac output and blood pressure and all those regulation factors. All right, I'll talk to you soon. Bye.